Welcome to the 360X Transitions of Care demo. The 360X project was initiated by ONC, and originally it was intended to enhance referral management. But since we've extended this to include additional care transitions, environments that include long-term post-acute care, as well as social determinants of health referrals. Importantly, 360X is not a product. It's an IHE-approved standard which will be live in practices in 2021. The specification employs proven standards that are ubiquitous throughout the health information technology industry. C-CDA and other documents attachments provide the critical, necessary clinical information. The discrete data in the C-CDA allows for semantic interoperability, reducing documentation burden and transcription errors, as the recipient can create a new patient chart from this data or reconcile an existing chart. Direct, a requirement of all certified electronic health record systems, is used for private and secure transport. XDM metadata provides the context of the exchange and can facilitate message routing in the recipient electronic health record. HL7 V2 messages are used to track the transition of care progress and/or gaps in care until the loop is closed. You'll see this in the demo. Additional HL7 V2 messages that are not being used in the demo include no-show or cancel or reschedule. The standard also requires a unique patient ID and referral transfer that persists throughout the process until that transition loop is closed. The primary goals of 360X via Direct are to enhance communication across care transitions, thereby improving the quality and efficiency of care that is provided, while decreasing dramatically provider and staff workload, documentation burden, reducing or eliminating transcription errors, and decreasing the cost of care by eliminating unnecessary duplicate testing and providing more efficient care. Our patient today is Donnie Boyd. He's a 75-year-old long-term heavy smoker with morbid obesity, a history of type 2 diabetes, COPD, hypertension, and hyperlipidemia. He had consistently refused COVID-19 vaccination and unfortunately was then hospitalized with COVID, admitted to the ICU because he required immediate intubation at the time of hospitalization. Subsequently, the hospital needed the bed and he was transferred to a long-term acute care hospital for weaning from the ventilator. Prior to this hospitalization, he'd been living alone independently, but he did receive once-weekly home health services for assistance managing his multiple medical conditions. He's now been weaned from the ventilator and is ready for discharge from the long-term acute care hospital. They've arranged for home health services to be bi-weekly for shower and laundry assistance due to his functional limitations. At the time of his discharge to home from the NetSmart Long-Term Acute Care Hospital, per the condition of participation regulation and using this standard, the NetSmart Long-Term Acute Care Hospital sends discharge notifications and a summary C-CDA over the MedAllies HIMSS to the patient's PCP and to the home health agency where he was receiving home care services prior to his COVID-19 related admission to acute care. The PCP practice using ECW receives the notification, schedules the patient for a follow-up appointment within 48 hours of discharge, and reconciles the discrete problems, allergies, medication, immunization data into the existing patient chart from the discharge C-CDA. The home health agency, using Matrix Care, puts the patient back on the home health visit schedule and reconciles the patient chart. Let's see this condition of participation message receipt and response in the Matrix Care home health system. Over to you, Ryan.
All right, thank you, Dr. Miller. Ryan Stutzman with Matrix Care. So as you can see on the screen, we have received the discharge notification as well as the continuity of care document for Donnie Boyd. Donnie's care team is notified that the discharge has taken place, and as you can see here, there is a summary view of the continuity of care document, as well as several tabs for reconciling the different discrete data elements of that C-CDA. Most notable in this scenario is the new diagnosis. So as you can see, we have the previous diagnoses that were on Donnie's chart, and then the additional diagnosis of COVID that I can select here and add it to the patient chart. Additionally, Donnie is placed back on the schedule on a biweekly basis, and care is resumed for Donnie Boyd. And back to you, Dr. Miller.
Thank you, Ryan. At Donnie's follow-up visit with his primary care physician a day after his discharge, he complains to Dr. Massoud of a severe itchy rash and terrible debilitating headaches. He also continues to have fatigue and greatly diminished capacity. Dr. Massoud and Donnie talk about these complaints, and they agree that he should have 2 visits to 2 different specialists. For the rash, he needs an encounter with a dermatologist and a neurologist for his headaches. Dr. Massoud orders a referral to Dr. Anderson, a dermatologist, and a referral to Dr. Allen, a neurologist. Let's see this in the PCP's ECW system and then in the next-gen system.
Thank you, Dr. Miller. Hi, everyone. My name is Trey Forts. I'm an integration team lead with eClinicalWorks. Today on the screen, you're seeing the eClinicalWorks web EMR. I pulled up the encounter with Donnie Boyd. On the progress note, you can see that I've documented a chief complaint of headache and rash, as well as the current medication, which is glipizide, lisinopril, and Lipitor. A little further down on the progress note, you'll see I've added the vitals for today's encounter, as well as the assessments. Those diagnoses include the rash, diabetes, chronic headaches, pulmonary disease, as well as the COVID diagnosis. Now, Dr. Massoud has queued up a referral, electronic referral. However, we're going to demonstrate that referral workflow from the electronic referral hub. So I'm going to navigate over to that screen where you can see the referrals are already queued up for the referral coordinator by Dr. Massoud. The first referral that we're going to click on is for the dermatology specialist. You can see the from provider, Dr. Massoud, automatically populates, and the 2 providers, Dr. Anderson, a dermatology specialist over at the next-gen system. And I found Dr. Anderson using the Direct Trust directory, which is preloaded into the eClinicalWorks software. The reason for the referral is the persistent rash, and I've added the diagnosis. If I click on the attachments tab, you'll see that I've added a PDF image of the rash as well. So now I'm ready to send this referral electronically. I can do so by clicking on the Send Referral button in the bottom right-hand corner of the screen. In doing so, this generates a unique 360X ID in the background that we'll use to link the status from the next-gen system to the electronic referral that was sent from eClinicalWorks. Now, in addition to the dermatology referral, we also have a referral for the neurology specialist. So we'll go ahead and click on that referral. And again, this is essentially a clone referral, so the from provider is Dr. Massoud. We're now sending to Dr. Allen, a neurology specialist who uses the Epic system. The reason is chronic headaches. I've added the diagnosis and attached the C-CDA for today's encounter. So now we're sending that electronic referral electronically, and that generates a new unique 360X ID on the background that again we'll use to link the status from the Epic system to the original referral sent out from eClinicalWorks. So now I'll send the screen over to Dimitri from NextGen to demonstrate the NextGen workflow. Thank you.
Thanks, Trey. Hi, everyone. My name is Dmitry Shalamov. I'm with NextGen Healthcare. And in this use case, we are going to demonstrate receiving of this referral request from the PCP specialist. So we are playing a role of dermatology specialist, and we start with seeing this new request they just sent few seconds ago from ECW, arriving to workflow inbox of for someone at the practice who is playing the role of the referral coordinator. So we're able to see referral reason, persistent rash, when we receive this referral and who sent it. So in this case, it's Dr. Peter Massoud. So I'm going to go ahead and accept this referral, and it's going to send this referral response back to PCP, indicating that this referral has been accepted and we're going to treat the patient. Dr. Miller, back to you.
Thank you, Dimitri. Donnie's also been referred to Dr. Allen, a neurologist, using EPIC. This was because he was complaining of the severe debilitating headaches, and Dr. Masood was concerned with his very significant coronary vascular history that he might have a stroke, a bleed, or something else in the brain. Dr. Allen's office staff received the referral, check her availability, and are able to accept that referral. There is scheduling capability in the 360X standard. However, today we're demoing Argonaut FHIR scheduling capabilities in the ECW and EPIC systems to emphasize how additional technologies can complement the workflow of the 360X standard. So, starting out, once Dr. Allen's office accepts the appointment, eClinical Works, using the Argonaut FHIR scheduling specification, requests an appointment in the EPIC system. The EPIC system then responds with available appointment times. The staff in Dr. Masood's office select the appointment best suited for the patient and books the appointment in the EPIC system. Note how the appointment shows up in Dr. Allen's appointment schedule within the EPIC system. At Donnie's dermatology encounter a few days later, the dermatologist reviews the chart and opens the PDF of the rash in the next-gen system. The patient then has a consultation with the dermatologist. Please now direct your attention to the next-gen screen where we'll walk through this process. Next-gen has received the C-CDA, and as Donnie is an existing patient because the dermatologist had seen Donnie once before, Dr. Anderson reconciles the new COVID-19 diagnosis in the chart. Next, he opens the PDF to see if the rash has evolved because he's got the patient in front of him and he has the photograph of the rash taken a few days ago. Dr. Anderson then, in his chart, diagnoses COVID, most likely related COVID to COVID, a maculopapular rash by exclusion, and enters that diagnosis in the system. He then prescribes a topical steroid aerosol for the patient to relieve the itchiness. Once the consult is completed, in real time, as soon as that's completed, his office staff then send the consult back to Dr. Masood, the primary care physician, closing the referral loop. Please direct your attention to the ECW screen where we'll show receiving the consult CDA, and the receipt closes the information and Dr. Masood reconciles that in ECW. Please now direct your attention to the ECW screen where we'll see ECW receive the consult C-CDA. That receipt closes the consult loop and the information is reconciled by Dr. Masood in the ECW system. Later that week, Donnie also goes to his appointment with the neurologist using EPIC. While I'm speaking, please watch the EPIC system. Once the patient checks in, a new patient chart has been created with the discrete data from the C-CDA. As the patient is roomed, this data is verified with the patient. The patient then has a consultation with the neurologist. Dr. Allen's also concerned about Donnie's headaches given his history and decides to order a brain CT scan. Please follow the prior authorization process for Dr. Allen. At the time of ordering the head CT, the decision support system using CDS hooks and the CDR DaVinci specifications verifies the need or not for prior authorization from the patient's insurer using and this insurer is using the Metals system. This is another example of how 360X can integrate with other standards like FHIR. We chose this standard for prior authorization because it is the standard CMS cited in its interoperability rule. The payer system then provides notification to the provider right within her Epic workflow. She doesn't have to go to a portal. She is in her Epic system. The notification provided is the conclusion that for this head CT scan, prior authorization is not required based on the documentation that has already been entered in the Epic system. The neurologist, having received the prior authorization result immediately in real time, is then able to obtain a same-day head CT for Donnie. She reviews the head CT and rules out an infarct, trauma, or bleed, and diagnoses the patient by exclusion with likely COVID-19 sequela headaches or long COVID. She prescribes a steroid taper. She also notes that the patient, having done a full neurological exam, is really unable to complete his activities of daily living and is too debilitated from his recent illness to be living alone at home, and recommends skilled nursing facility placement. Neurology staff return the C-CDA with the consultation and the CT report, as well as a PDF of the brain CT image, to the PCP in real time once that consultation is completed, via 360X Direct, with a recommendation for placement in a skilled nursing facility. Dr. Massoud receives the neurology consult. This closes the referral loop. Dr. Massoud arranges a same-day visit with Donnie to go over these results, and because he's concerned about Donnie living alone now that the neurologist has made a recommendation for SNF placement. Donnie agrees that he really is not capable to be living home alone and agrees to SNF placement. Dr. Massoud, using eClinicalWorks over 360X via direct long-term post-acute care functionality, sends a referral request to Donnie's skilled nursing facility of choice with the C-CDA and a required patient review instrument as a PDF. Let's see this in the ECW systems.
Thank you, Dr. Miller. So now we're back in eClinicalWorks on the electronic referral hub. And if I click on the electronic referral status, you can see that that request has been accepted and the loop has been closed. So this lets my referral coordinator and Dr. Massoud know that there's a new 360X C-CDA that's ready to be reconciled. So we're going to navigate back to the progress note for the encounter with Donnie. And we see we have a new C-CDA attachment that was received via 360X. Now, because the C-CDA was received via 360X technology, it automatically attaches to the patient chart. So if I click on that C-CDA, it's going to open a pop-up where we see the problems, allergies, and medications that were included in the C-CDA. Now, after a conversation between Dr. Massoud and Donnie, we verify that this clinical information is accurate, and we can discreetly import each element by clicking on the blue arrow. Now, in addition to the reconciliation, we also have the C-CDA attachment, as well as the CT brain scan, with a note that there is a recommendation for placement in a skilled nursing facility. So that brings us back to the electronic referral hub, where we can see Dr. Massoud has queued up a new referral request to the skilled nursing facility. If I open that electronic referral, we can see again the front provider is Dr. Massoud. It's now going to Candace Jones over at the skilled nursing facility with the reason of admission request, as well as the diagnosis. If I click on the attachments tab, you'll see I now have a PRI for Donnie attached to that request. So now I'm ready to go ahead and send this referral electronically, again generating that unique 360X ID that we'll use to link the status back from the skilled nursing facility who uses NetSmart to the referral that was sent out from eClinicalWorks. Now I'll pass the screen back to Dr. Miller.
Thank you, Trey. The NetSmart skilled nursing facility receives the request, reviews the C-CDA and the PRI, and determines that they are able to care for this patient and send an accept notification to the PCP. Let's see this process in the NetSmart system.
Thank you, Dr. Miller. Hi, my name is Nikki Gross. I'm with NetSmart, and I'm going to show you the 360X referral coming in from the PCP. So you can see that I've received that SNF admission request. Along with that, I get Donnie Boyd's C-CD with all the pertinent information that came from his PCP, his medications, his problems, reason for referral, etc. I also get that PRI document that I can also review as part of the referral process. As the intake coordinator, I'm going to determine whether or not I have availability for Donnie Boyd, and I'm going to manage this referral. If I didn't have availability, I could select the reject option, but in this case, I do have availability for Donnie. I'm going to select accept and save that referral. When I save this referral, it's going to send back that 360X notification back to the PCP and using eClinicalWorks, and it also gives me an option to add any additional comments that might be needed as part of that referral process to send back to the PCP. Back to you, Dr. Miller.
Thank you, Nikki. Please direct your attention to the ECW screen. The PCP eClinicalWorks sends a confirm SNF selection message to the selected skilled nursing facility. This confirm accept patient transfer notification is very important because often when you're transferring a patient to a skilled nursing facility, you might send a request to multiple skilled nursing facilities. Several of those might accept the patient, and you need to confirm which of those skilled nursing facilities is going to be admitting the patient. So Dr. Massoud sends that confirm message to the NetSmart skilled nursing facility, and they know to anticipate that Donnie is going to be admitted to their facility. Donnie is admitted that same day, and that's happening because all of these messages are in real time to the selected skilled nursing facility where he gets the daily care and attention he requires. At patient admission, the skilled nursing facility creates a new patient chart from the C-CDA that was received from Dr. Massoud, and they send the PCP as well as the home health agency admit notifications. The PCP staff receives and reviews the notification. This closes the referral loop. Let's now see this in the NetSmart and then in the Matrix Care system.
Thank you, Dr. Miller. All right, so back in Care Connect inbox in the NetSmart system, I'm going to go back to Donnie Boyd's CCD, and this time I'm going to select to admit new client. When I admit the new client, it's going to take me to our admission form, and it's going to pull in all of that discrete data from the demographics, such as the date of birth, as well as you can see date of birth, as well as the address information. This is going to remove any manual keying, and which can result in keying errors when you're having to do that duplicate entry. I'm also going to perform a clinical reconciliation. So all of the information that was imported in from that CCD, problems, allergies, and home medications can also be automatically imported into the client's chart. As part of this admission process, again, I'm going to send an automatic admission message back to the PCP using eClinicalWorks. I have the ability to send additional comments, but when I send this response, I'm also going to send that condition of participation to Matrix Care, which is the home care agency, so to notify them that he has been admitted to the SNF. Let's see this in Matrix Care.
Okay, thank you, Nikki. So back in the Matrix Care system, you can see that admit notification has been received by Donnie's care team. And based on that notification, they are able to go in and change the status of Donnie's admission to transferred on hold with a reason of transfer to a skilled nursing facility. And as soon as I save this new status, both of the biweekly visits are both canceled, and the home health care team knows not to show up at Donnie's doorstep for the next visit. Both of those visits have been canceled. And I will hand it back to Dr. Miller.
So what we think you've seen, or what we hope you've seen, is that pushed essential information in real time during care transitions decreases provider burden and cost, enhances the quality and efficiency of care, as well as enhancing patient, caregiver, provider, and staff satisfaction. Referral management has long been a time-consuming and very frustrating process. Patients get lost in the cracks, they do not get the care they need, and 360X allows for transparency of the progress of transitions of care throughout the entire process, ensuring that patients receive the care that they need. We'd like to thank Brett Andreessen, who's been heading up 360X for ONC, as well as the following standards organizations. These are the standards that you've seen demoed throughout this demonstration that are part of the 360X IHE approved standard. Thank you so much for watching our demo. For more information about 360X, please take a white paper or simply ask us questions. Thank you for your attention.